Hello guys, welcome and welcome to Media Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as NCLEX, IELTS and OIT training. Today in this session, we are going to discuss in detail about the previously year questions which is very useful for you for the upcoming NORCET examination. So let's begin the session without wasting the time. So the first question what we are going to say is, which of the following is a fracture in which the bone is shattered into numerous fragments? See guys, in a single reading of the question, you should understand the concept which is present within it. For example, I am reading this question, which of the following is a fracture in which bone is shattered into numerous fragments? A bone which is broken into numerous fracture. That is the question. So here the keyword which is present within the question is numerous fragments. The bone broken into numerous fragments. This one will automatically take you to the option C, that is comminuted fracture. So what is comminuted fracture? A bone which is broken into numerous fragments. It is called as what? Comminuted fracture. So here the right answer is option C. Whereas option B, that is avulsion fracture, in which there is a fracture and the fractured bone is attached to the soft tissue. So here which is the key point? Soft tissue bone, the fractured bone which is attached to the soft tissue, that is called as what? Key point. Okay, so that condition is called as what? Avulsion fracture. And spiral fracture, it is a fracture which is caused by the twisting motion. Spiral fracture is the one which is caused by what? Twisting motion. So twisting is the key point here. So based upon the key point, you are supposed to click the answer. Okay. And the next one is false memory that the patient believed to be true is. So there is a false memory and the patient is believing that false memory is a true one. Otherwise, the patient is confused with the imagined scenario with actual scenario. The patient is believing the imagined scenario as a true one. So that is called as what? This statement or this question will directly take you to what? Option A, that is confabulation. Okay. And the other options like fugue. What is fugue? It is amnesia. Fugue is also called as what? Amnesia. Loss of one identity and following a new identity. The person who is suffering from fugue loss his own identity and following a new identity. Example, if you saw Onion movie, Vikram movie, you would have been known that he is getting a new identity and following that identity. Okay, so that is called as what? Fugue. And next one is cataplexy. The definition or meaning of cataplexy is sudden brief loss of voluntary muscle tone. This is the keyword. Loss of voluntary muscle tone, which is triggered by the strong emotions. There is some psychological problem which is exposed out by means of voluntary muscle tone loss. Okay, and the last one is anergia. It is nothing but abnormal lack of energy. That is called as what? Anergia. Okay, so this false memory that the patient believed to be true, this statement will take you to what? Confabulation is the answer. And the next one is direct question. When is the fertilized ovum is known as embryo? When is the fertilized ovum is known as what? Embryo. And here they have given 4 options and here the right answer is option A, that is 0 to 8 weeks. So what is embryo? From the time of fertilization till the end of 8th week, development of fertilized ovum is called as what? Embryo. Once again I am repeating, from the time of fertilization. See, usually what is the meaning of fertilization? Fusion of male and female gamete. It will happen after the ovulation within 12 to 24 hours. After ovulation. Okay, after ovulation within 12 to 24 hours. That is called as what? Fertilization. Okay, fine. See, after ovulation, the ovulation will take place in the 14th day of the menstrual cycle. So after ovulation within 12 to 24 hours, okay, this fertilization process will take place. Okay, that is called as what? Fertilization. So when the fertilized ovum is known as embryo, this is the question. So here the right keywords are from the time of fertilization till the end of 8th week. Please understand this concept. From the time of fertilization till the end of 8th week. Okay, so that time it is called as what? Embryo. So here which is the right answer? Option A, that is 0 to 8 weeks. And next one is very simple direct question. Flag sign is the characteristic feature of which disease? See, this is the keyword here. What is the keyword here? Flag sign. So flag sign. Flag sign is commonly seen in which disorder or which disease? Kwashiorkor. Okay, option B is the right one. Kwashiorkor is the right one. So what is Kwashiorkor? It is a protein energy malnutrition. There is a big difference between the Kwashiorkor and marasmus. Many students will make the mistake here. See, Kwashiorkor in the sense, here there is a protein is malnourished. Protein energy malnutrition is present. Okay, the first golden point is protein energy malnutrition, and second point is edema will be present for the Kwashiorkor patient. And next one is prominent belly will be present. So these are all the characteristic feature of Kwashiorkor. Along with that, flag sign will also present. What is flag sign? Band of discoloration of the hair. Band of discoloration. In the hair there is a discoloration. Bunch of hair color will be totally changed. This is called as what? Flag sign. So these are all the classical characteristics of Kwashiorkor. What about marasmus? In marasmus, not only protein, fat, carbohydrates, all nutritions are decreased. The person is suffering from lack of protein, carbohydrate as well as fat. That is what's seen in the marasmus. In marasmus, there will not be any edema, and here there will not be any protruded belly. Instead of protruded belly, severe muscle wasting will be there. What will be there? Muscle wasting will be there. Okay, and the next one is rickets. So what is rickets? It's a very easy one. That is, it is a childhood disease which is caused by the deficiency of vitamin D. Here, softening, weakening of the bones, bone deformity, all these characteristics features will be there. And the last one is poliomyelitis. See, poliomyelitis mostly affect the under 5 children. The first key point, very important point. And second one is it damages the nerve cells. Which cells? Nerve cells damage will be there. Okay, afterwards it will cause what? By means of damaging the nerve cells, it will cause what? Muscle paralysis. Okay, and how it will transmit? The poliomyelitis, it will transmit through the food and water. Food and water. Okay, and OPV is the vaccine which is OPV and IPV. These are all the vaccines which is given for what? Poliomyelitis. And one more important point, this polio virus, it will multiply in the intestine. Okay, fine. Otherwise, the virus will replicate in the intestine. Okay, so at last, the answer for the fourth question is option B, that is Kwashiorkor. Okay, and the next one is optimum temperature for the growth of most pathogenic bacteria is. So here the keyword is optimum temperature for the growth of pathogenic bacteria, and here the right answer is option C, that is 37 degrees centigrade. It is a direct question. And the next one is question number 6. Which artery supply oxygenated blood to the stomach? Direct question. And here the right answer is option C, that is celiac artery. The celiac artery is the one which is supplying the stomach. Okay, and also superior mesenteric artery is there, inferior mesenteric artery is there. These things will supply the intestine. Okay, fine. And the next one is question number 7. What should be the temperature of water used for cold sponging? Here the keyword is temperature of water for cold sponging, and it will take you to the answer C, that is 70 degree Fahrenheit. Answer is option C. And the next question is question number 8. Radioactive cobalt and radium are used for the treatment of disease. See, whenever you come across radioactive, radium, cobalt, you have to think about what? Cancer. Okay, so it's the same mechanism here also we supposed to apply. These keywords will take you to the option C, that is cancer. Okay, other options like hemophilia. What is hemophilia? It is a X-linked X-linked recessive disease. There are two types of hemophilia, hemophilia A and hemophilia B. Two types of hemophilia is there. Okay, for example, hemophilia A means here factor 8, clotting factor 8 is affected, that is anti-hemophilic factor is affected or missing. The exact word is missing. Hemophilia A and hemophilia B are the two types of hemophilia. It is a X-linked recessive disease, and hemophilia A means factor 8, anti-hemophilic factor is missing, and hemophilia B means factor 9, that is Christmas factor is missing. These are all the golden points which is related to hemophilia. Sickle cell anemia. It is also a inherited disorder. Okay, so here what is happening? The shape of the RBC is like or transformed into sickle shape or crescent shape or banana shape. Okay, and here what is happening? The hemoglobin is affected here. Understand? So these are all the keywords which is related to sickle cell anemia. So whenever you are discussing or studying about a question, for example, this is a question, right? So you are studying one question. In one question, how many options are there? 1, 2, 3, 4. 4 options are there. So you should think about the rational or possibility of questions related to these options. Okay, so if you are thinking about the questions or rational which is related to these options, you will be getting brainstorming more information you can get from these 4 options. For example, just now I said hemophilia. Hemophilia means immediately you have to think about what hemophilia A, hemophilia B. It is a X-linked recessive disorder. So which factor is missing here? So like this, as a chain, you have to connect and you have to read. This is how you supposed to read. Okay, and the next one is question number 9. The first course of oral pill should started on dash day of menstruation. Here the keyword is first course of oral pill started on which day of menstruation. So usually after or 5th day of menstruation is the right one, but here 5th day, that option is not there. Then we can go to the nearby answer, that is 7. So here option B is the right one, 7th day. And question number 10, amount of solution used for evacuant enema in adult. See, here the keyword is evacuant enema in adult. This one will take you to the answer C, that is option C, 500 to 1000 ml for evacuant enema. Direct question. The next one is media of transmission of bovine type of tuberculosis bacilli. So first the keyword is bovine type of tuberculosis bacilli, mode of transmission. What is bovine? You all know tuberculosis bacilli. What is bovine? See, there are 3 types of tuberculosis bacilli, guys. How many types? 3 types. The first one is human tuberculosis bacilli. Second one is bovine tuberculosis bacilli. Third one is tuberculosis bacilli. And this bovine type is commonly seen in the cow milk. Which milk? Cow milk. So that's why here we are using the media of transmission of bovine type of tuberculosis bacilli as a unpasteurized milk. So here which is the right answer? Option A, that is unpasteurized milk is the right answer. And question number 12, mode of transmission of typhoid fever, direct question. And here the right answer is option B, that is fecal-oral route. Simple and direct question. Question number 13, infective period of Aedes mosquito in dengue. Okay, in dengue. See, Aedes mosquito, for example, Aedes aegypti means it will cause what? Dengue, chikungunya, all those Zika virus, all those means diseases it will cause. Okay, and here they have specifically mentioned infective period. That is the first keyword of the Aedes mosquito in dengue. Specifically they are asking dengue, and here the right answer is option B, that is 8 to 10 days. And next one is Lyme disease. What is that? Lyme disease. See, Lyme disease means immediately what should come into your mind? 2 things has to come into your mind. The first one is organism and second one is bull's eye rash. Most commonly these 2 questions are frequently asked in the examination. Lyme disease means 2 things has to come into your mind. The first one is organism. Okay, Burgdorf feri. This is the organism, Borrelia burgdorferi. And the next one is Lyme disease is infected. The person is infected with the Lyme disease means the person will be having a rash. The characteristics of the rash will be bull's eye rash. Bull's eye rash. So how this bull's eye rash will be? The center will be clear and the surrounding will be red in color. This is how the rash will be. The center, this area, this is the center, right? This center will be clear. There will not be any rash in the center. It will be clear. Okay. Only in the surrounding there will be a circle or erythema in the outside. Okay. That's why it is called as what? Bullseye. So these two things has to come into your mind or strike into your mind while you are coming across Lyme disease. Question number 15. Percentage of sodium hypochlorite used for disinfecting HIV infected liquid waste. If you are working in a hospital setup, spill management, if you would have studied about the spill management, infection control, then you would have been known about these things. Okay, and here the right answer is option A, that is 1%. 1% of sodium hypochlorite will be used for disinfecting the HIV infected liquid waste. Okay guys, fine. The next one is question number 16. Dose of human tetanus Ig for post-exposure prophylaxis. So here this is the direct question. Here the question is dose of human tetanus antibody for post-exposure prophylaxis. After once the person got infected. So now he is taking post-exposure prophylaxis. Now he is taking the treatment for human tetanus virus. Okay. And how much units of antibody you will be giving to the patient? And here the right answer is option A, 250 to 500 units. Okay, and the next one is question number 17. Type of hypersensitivity involved in RH incompatibility. And here they have given 4 options: type 1, type 2, type 3, type 4. The first important thing what you supposed to know is other name of these type 1, type 2, type 3 and type 4 hypersensitivity reaction. The other name of type 1 hypersensitivity reaction is anaphylactic reaction. What reaction? Anaphylactic reaction, which is caused by IgE antibodies. Anaphylactic reaction, allergic reaction. And second one is type 2 hypersensitivity reaction. It is also called as cytotoxic reaction or cytotoxic hypersensitivity reaction. Here two antibodies are playing a vital role, that is IgG as well as IgM. These are all very important golden points, guys. And the next one is type 3 hypersensitivity reaction. Here immune complex mediated hypersensitivity reaction. What is that? Immune complex mediated hypersensitivity reaction. Here neutrophils are playing a vital role. And type 4 hypersensitivity reaction is also called as delayed hypersensitivity reaction. What is that? Delayed hypersensitivity reaction, also called as T cell mediated hypersensitivity reaction. Let me give you one example. Multiple sclerosis. Just now we completed the neurosensory class. Multiple sclerosis, it is an example of type 4 hypersensitivity reaction. Myasthenia gravis is an example of type 2 hypersensitivity reaction. Okay, fine. And let's come to the question. In this question, what they are asking is type of hypersensitivity reaction in RH incompatibility. Here the right answer is option B, that is type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction. Okay guys, fine. The next one is question number 18. Antibiotic used in toxic shock syndrome. It is a direct question. It will take you to the option antibiotic clindamycin. Option D is the right one. Question number 19. Gram-positive bacteria usually sensitive to penicillin is. Gram-positive bacteria usually sensitive to penicillin antibiotic is. And it is a direct question again. It will take you to the answer option C, that is Staphylococcus pyrogens. Pyrogens, that is Staphylococcus pyrogens, are most sensitive to penicillin antibiotic. Question number 20. Contact dermatitis is which type of hypersensitivity reaction? And here the right answer is option D, that is type 4 hypersensitivity reaction. It is also called as what? Delayed hypersensitivity reaction, also called as T cell mediated hypersensitivity reaction. Already we saw one more example also, that is multiple sclerosis also coming under what? Type 4 hypersensitivity reaction. Type 2 means myasthenia gravis and also RH incompatibility. Type 4 means multiple sclerosis as well as contact dermatitis. Okay, and the next one is glassware and syringes are sterilized by. It is related to sterilization, and here the keywords are glassware and syringes. These are sterilized by. And they have given 4 options, and here the right answer is option D, that is hot air oven. Okay, hot air oven is the right answer. Okay guys, fine. So the next one is question number 22. Which of the following is a gram-positive cocci? So here they have given gram-positive bacteria as well as gram-negative bacteria, and they are asking which is the gram-positive bacteria. And here the right answer is option A, that is Streptococcus. Streptococcus is a gram-positive bacteria. The next question is question number 23. Anti-D given to RH negative pregnant woman with RH positive fetus before delivery is an example of. So understand the question. So anti-D immunoglobulins or antibodies you are giving to the RH negative pregnant woman with RH positive fetus. Mother is negative, fetus is positive. Okay, that time it is called as what? RH. Okay, RH factors. Before delivery is an example of. They have given 4 options, that is artificial active immunity, artificial passive immunity, natural passive immunity, adaptive immunity. First you should know the meaning of each and everything. Let me give one examples of each and everything so that it will be easy for you to understand. The first one is artificial active immunity. The best example is vaccination. Artificially you are giving vaccination and you are producing the active immunity. Remember, vaccination for active immunity, artificial active immunity. And the next one is artificial passive immunity. Here you are injecting the serum containing the antibodies. Serum containing the antibodies. For example, for a RH negative pregnant woman, you are giving the anti-D serum, anti-D antibodies. So it is coming under what? Artificial passive immunity. Option B is the right one. What about other 2 options? Natural passive immunity. The best example is antibody which is transferred from the mother to the baby through the breastfeeding or through the placenta. That is called as what? Natural passive immunity. Naturally the baby is getting the immunity. And the next one is adaptive immunity. See, once the person is exposed to infection, once the person is exposed to vaccination, after that the person himself is producing the antibodies against that particular virus. For example, the person took vaccine for measles. After taking vaccine for measles, the person himself developing the antibodies against the measles for lifelong. That is called as what? Adaptive immunity. The next one is question number 24. Sensitization of heat liable media is done by. Not sensitization, it is a sterilization of heat liable media. Sterilization of heat liable media is done by. And here the right answer is option D, that is tyndallization. See, always remember, heat liable media is the keyword. Sterilization of heat liable media. If you are getting this keyword, directly you can go for what? Tyndallization. What is tyndallization? Heating for 80 to 100 degrees centigrade for 30 minutes. Heating 80 to 100 degrees centigrade for 30 minutes and then it is incubated. Sometime continuously it has to be done for 3 days. Okay, so it is used for heat liable media. So this is called as what? Tyndallization. And the last one is Klebs Loeffler's bacillus is the name of. Direct question, and here the right answer is option C, Corynebacterium diphtheriae. Okay, so these are all the answers for these 25 questions. Okay, so thank you guys. If you have any doubts anywhere in this question discussion, you can comment us in the comment section. And if you like this video, please like it, share it, subscribe it, and support our channel. Keep on watching again and again for understanding the concept and rationale within each and every questions. Thank you very much, guys.